fellow viewers, and welcome once again to the Manifest Direction. Uh, we have an episode for you where we have a team of experts talk to you surrounding the coronavirus pandemic and how we can address it in various ways that you hear from the experts. Uh, we have a solid team today. I'm pleased to introduce to my left Dr. Luke Ba, the medical expert, studied medicine in Nigeria, in India, in the UK, in Senegal, and has practiced medicine as a consultant with the National Hospital, Abuja. He has also managed within the space, successfully managed out people who were down with coronavirus, and we thought that we should add value to you by inviting Dr. Ba to speak to you on how you can come out of the COVID-19 nightmare, living your life normally. Dr. Ba, you're welcome to the program.
Thank you, Mr. Denga. It's my pleasure.
We also have a senior lawyer amongst us, a human rights expert, and a member of the Police Service Commission. These are times that if we don't take time, human rights will be violated. So we thought that we should also uphold our rights despite the pandemic, and there is no better person to have called in than someone who is a lawyer, who is a human rights expert at the national level. He participated in the national conference of Nigeria, representing the human rights community. He's a civil society organization leader and agglomerator. He is also the president CEO of Lawyers Alert International in Ghana. And lastly, he serves the country Nigeria as the Police Service Commissioner for North Central, representing the human rights community. Help me welcome Barrister Romy Mom.
Thank you, Mr. Denga. It's good to be here.
Thank you. And then to Romy's right, you have a taxation expert. He worked with different banks in Nigeria, rising to regional levels before he transited to help governments across Nigeria improve their tax bases, tax revenues, tax practices, so they can have more money to bring more development to governments. So now he is managing revenues for subnational government called Benue in Nigeria. Help me welcome Mr. Andrew Ayaba.
Thank you, Max. Thanks for having me.
Without wasting too much time, we will start where it's hurting the most by talking to Dr. Ba to tell us more about managing crisis, the coronavirus crisis, and why there is confusion in managing the crisis, be it individual level or hospital level. Dr. Ba.
Thank you. When coronavirus came in as a novel infection, and as a new infection, most experts find it difficult to know how it presents, how it is transmitted, and how the extent which of the organs are involved. So it came in when the world was not prepared for it, and therefore the expert needed to also study the infections, how it's transmitted, how it affects, and how it causes death among us. And so it has come a lot of challenges. Challenges to the government, challenges to the medical experts, and challenges to the patients and patient relations. At the government level, because the world was not prepared for coronavirus and it came in unprepared, most of the government had challenges. These challenges also involve resources involved in managing the case. And then because it comes in with mortality, it also came with a lot of fears. So the experts in the field were afraid, patients were afraid, and the family members were afraid. At the patient level, because this disease comes in with symptoms that are similar to other conditions, it is difficult to differentiate it from flu. It's also difficult for it to differentiate other infections that come in with fever and chest infections. So it was, in the first place, the major challenge was the diagnosis. Diagnosis in the sense that because it was a new infection and the scientific world were yet to develop the procedure in diagnosing it came with a lot of mortality. So the first initial part of the infection, there's a lot of mortality. So it created a lot of fears. And when the diagnosis was made, it's not as easy as when you just do take a sample to the lab and they get the result in the next few minutes. It takes longer in time to investigate. So that bigger challenge of investigating patients who come in with COVID-19 became, even the developed world in America and others, it was difficult for them to come up with or screen a lot of patients. So as I'm talking to you, a lot of people who have the disease are still having challenge in having the diagnosis. Having those who will investigate them and having those having the result come out in time. It takes up to 1 week to come out with the result. So that's the first challenge. The second challenge is having the drugs treatment. The protocol in treating patients who come in with the disease became difficult because so many experts came out with different drugs combinations, different treatment protocol. Just like you can say, a lot of experts came out with the intention of treating the patient with chloroquine, and chloroquine was difficult because some people claim that chloroquine was causing a lot of mortality. It was even worsening the mortality, while others say that chloroquine was a better drug because there was no mortality. Personally, the biggest challenge is that the scientific world have discovered a treatment option for COVID-19, and that is resvir. The resvir is a drug, antiviral drug that is discovered, but it's expensive. Expensive in the sense that most patients and government cannot afford, and that is a challenge. So there's a lot of confusion both in the diagnosis, confusion in investigations, diagnosis in the treatment, and then also difficult because patients and experts initially, because this comes with a lot of stigma, there's a lot of confusion. So confusion will continue until the scientific world are able to find a solid and cheap method of treatment. Thank you.
Thank you so much, Dr. Ba. We'll come back to you. You've raised very interesting scenarios, but we'll come back to you. Thank you. Moving on to our legal, human rights, and international expert. By the way, Romy Mom also served the government of Nigeria in the Constitutional Conference as the human rights representative. His scholarship has taken him to Europe, America, and other parts of Africa. Barrister Romy Mom, as a human rights expert, kindly talk us through the implications of COVID-19 vis-a-vis human rights in the world, in Africa, in Nigeria.
Well, I think COVID-19 as a virus doesn't have any human rights implications, but it's the reaction to the virus that led to a lot of human rights implications and by extension violations, because we militarized the space immediately this happened, so as not to, pass on the virus from person to person. What that led to was what we call the lockdown. And in the midst of the lockdown, we were trying to enforce lockdown and all of that. And all these things was a global act, but that was not contextualized within our spaces. And so in Nigeria, for instance, you had persons who were on daily income, persons who could drive a taxi and come back to feed their families, persons who could go vulcanizers who could do a day's job and go to feed their families. Now you're saying don't go out at all, stay at home for 3 weeks, for 1 month. How are they supposed to feed their families? So that led to a lot of psychological trauma. That led to a lot of loss of self-esteem. People could no longer feed their homes, and all these are human rights that were violated in the course of that. Some had to go out because they were ill and had to get medicine from pharmacies and all of that, and were stopped on the road. Some were beaten up. We saw the video of a woman who was beaten up in the kitchen because she was going out to get drugs. You have persons in Abuja, a taxi driver stripped naked because he couldn't bear the trauma of not going home with food to his family again. And of course, you know about the issues of rape that has escalated in this country. All that it owes to people staying at home and doing nothing, and that led to a lot of things that ordinarily maybe wouldn't have happened. I don't want to talk about the fact that even the courts were locked down. And when the courts were locked down, anybody could do anything to you. You couldn't go to court because the courts were locked down. Prisons were no longer taking prisoners. So the police stations were becoming more like prisons. And as they were arresting more persons and bringing them to the police station, that was how also the virus was spreading, because we had congestion at the police station. So there were a lot of human rights infractions that are tied, or that were tied to the militarization. So it's a reaction and not the virus itself. And so you can go on the types of violations that happen, but it's all tied to the lockdown and the implications of it.
Thank you very much. Quite interesting, President Rumi. We'll still come back to you. You've raised very pertinent issues that we must address to help our viewers. We will move to the expert on revenues, uh, Andrew Ayaba, who has been a banker at senior levels, managing regions for different banks before he transited to help governments set up revenue as a base for income so as to bring impact to society. Mr. Yaba, I would like to ask you, given the coronavirus, what is the way forward on taxation? What are your views? How is it impacting tax? What creative suggestions can you suggest to your colleagues around the world in managing tax revenues for government during the coronavirus?
Thank you, man. They say survival is the most basic of human instincts. So that's the first thing a human being wants to do is to survive, and then before they do other things. With Corona, so much has been challenged. Human existence has been challenged. So has also been taxation. But a challenge is what it is, and the best thing is to overcome it. And how do you overcome it in a world that is moving and moving, particularly the use of technology, which now plays a great role in how taxes are assessed, managed, collected, revenues are reported around the world. Coming home globally, there have been certain concessions that we've had to make in order to encourage voluntary compliance and also not to add further burden to the people, the taxpayers. Extended filing dates in the past used to be 31st of March. Now we extended even up to as much as September 30, and we continue to review the situation as time permits or the virus permits, so to speak. Uh, Taxpayers are now also able to assess themselves from the comfort of their homes, their offices, or wherever they are, the use of technology. You can process even taxpayer certificates from wherever they are. These are some of the few things that we've done. Governments have also granted concessions. In Benue, for instance, there's a 50% discount on payment for land processing. And hopefully, maybe the government will look at reducing certain other areas of social services to the people, such as education, healthcare, who seem to be heavily impacted by this virus. For now, maybe we can look at that.
Thank you very much, the tax expert, Mr. Yaba, for the wonderful insights you've given us. So we'll come back to Romy. As an advocate of community policing, um, how do you advise us to use it to tackle the various crises in Africa and the world, in Nigeria, in Africa and the world, which crises are going on despite the presence of coronavirus. You've spoken about community policing in the past. How do you use it to reduce the incidence of insecurity around Africa?
I think that's a very interesting one because if you ask me, all the crises you have in the world today, particularly in Africa, in Nigeria to be specific, are born out of lack of trust in the state apparatus, whether it's the army, whether it's the police. People are they're lukewarm towards trusting. So, for example, you can go out on the street now, a crime or an offense happens, and people are walking away from it. Why are they walking away from it? My own no day for police will go. I mean, I know when police took trouble. So people are actually moving away and not engaging the police and all of that. And the police over time it's a security outfit that is reactive in the sense that only when something happens before they go there, they are not proactive. And so community policing comes from the back end in trying to see that you have communities engaging with the police through trust, and then they are being proactive and not reactive. And so, if a community, for example, sets up a team that works with the police, they share information, there's trust, and all of that, the community can, alert the police to certain issues that are arising that have security implications. And if there is trust and harmony, the police can go on that platform still and quell those issues. And you can have this at various strata, whether at divisional levels, whether at headquarters level, whether at area command levels, whether at even outstation levels. And then when you aggregate this, you have a situation where a country is largely peaceful. And I think the time for community policing in Nigeria, for instance, is overdue. And I'm not talking about the community policing we're thinking of running now. Because what we have now that they're trying to put out there is not community policing, it's adding to the number of police officers. Community policing sits on the community and the policing coming together to aggregate resources towards solving and stopping crimes and offenses in their localities. This is very, very, very important. And we need to do this to quell crisis at whatever level, especially in states where we have this kind of crisis coming up so very often. The police and the communities need to come together. I'll use one word, and the word I'll use here is trust. Police keep being reactive and wait after criminals because there is no trust. If there is trust and the community and policing are in harmony, you will not have what we eat. The indicator, the decimal of crime in Nigeria will reduce by 100 to probably 10 is possible. And so I will think that for me, the issue of community policing is what governors, local government chairmen, and presidents should adopt and run with. It's long overdue.
Thank you very much, Pastor Romimo, for those insights. I know you have a template for it. When we dig deeper, we get to avail ourselves of the template and see how we can apply it to our communities and our situations. Dr. Back to you. We spoke about how coronavirus started and what the issues were. Now, in taking it further, let's look at the individual level. How do we then survive? How do we manage? If you have someone who suspects he has coronavirus, or if he has indeed, what does he need to do to stay alive, to overcome it, and to be healed, to be negative?
Anyway, when we are talking of survival in the disease state, naturally, it's like a defense. Somebody was attacked you, that's what people start defense. Now, the viral infections, most of the viral infections that we know, patients survive them because of the amount of immunity they put forward. If you look at HIV, some people they get infected, it takes 10 years for them to manifest infections. It takes 3 months. Depends on your immune response to infections. So, because of the confusion in the treatment and management protocol, especially now there is a new infection and governments and experts are yet to have a sound treatment principles, it's been more of advocative means to overcome the infections. We've noticed that some people just have infections, they just have a little cough and fever, and that is all they get over it because of the strong immunity before. And especially the elderly and those who have background medical issues are the ones who are dying. When you are old, it is expected that your immunity is low. When you have medical issues, kidney disease, heart disease, chest infections, and then other infections like immunosuppressives like HIV, such patients are said to be dying from the disease easier than those who are physically strong. And so what we advise, especially in the communities where they don't have money to go to the hospitals, where they don't have access to medical facilities, what we advise is to take foods that can boost your body's immunity. And therefore, what we advise that if you know you have symptoms that look like COVID-19 and you don't have access to medical facility, you can take some foods. And there on our tables, take ginger and lemon that can boost your immunity, that can detoxify your system because these infections come in And these are a lot of toxins in the system, and that's what actually kill. So improve your body's immunity with taking a lot of fruits, vegetables, and then a lot of protein diet. Because protein, most of the immune that we want in our systems are made from proteins. So take enough of meat, take enough of fish, and take a lot of fruits and vegetables. These food items we see every day can boost our body's defense mechanisms. Another thing we can do is to keep ourselves warm because infection seems to flourish in an environment that is cold. And that's why it's very common in the US and that's why it's common in Europe and America. Because it is actually an immune that flourishes in an environment that present in cold situations. And so keep yourself warm. What do I do if you know you have symptoms that look like COVID-19 or you have COVID-19 diagnosed, keep yourself warm by steaming. Steaming is a major treatment option. Steaming. And steaming can be done in your house. Boil water and then cover yourself with blanket and inhale the steam. It helps to destroy the infections within the lungs because we inhale this steam into the lungs. So it helps. I advise those who are person and there was no treatment option to do that, and a lot of them came out and they were free from the disease. Right. I don't mention names, but most of the patients that I was able to manage, this was just simple means of helping ourselves overcome the body's immunity, overcome the infections. Keep yourself warm, take fruits and vegetables, and then make sure that avoid cold environment. And that is most of the patients come out of it. Even in Europe and America, most of the patients survived the disease came out to confess that they survived it because they exposed themselves to hot environment and they got a lot of fruits and vegetables. So it's simple. The infection can be overcome. You must see the drugs. You must see the most of the people who survive it, not because of drugs. Those who don't make it are those who have background medical issues. And so because this infection comes with a lot of complications. So that's for the complication arising from COVID-19. So if you don't have medical issues, yes, you can overcome it. If you have medical issues, stay away from sources that can expose you to getting the infection. Thank you.
Thank you very much for those tips, wonderful life tips. The manifest direction is about helping you to cope with life and the issues that life throws at you. Remember that life will throw issues at you. You graduate one per time, you finish this issue. That doesn't mean that that's the end of crisis in your life. There will be a further test of life. So gradually you overcome until your time on earth is fully used and then you will expire. Thank you very much for helping us to cope with coronavirus, Dr. Ba. We thank you, Barrister Romy Moore, for your wonderful word on managing crisis and human rights under COVID-19. Thank you very much, Sayaba, for your expertise and the tips you've given us on how you've managed tax issues arising out of COVID-19. Perhaps you have one last word to say to viewers. Sayaba.
Yes, thank everyone. And for the support, particularly the tax-paying public, that in view of the challenges, we've also observed some level of say 65 to 70% compliance, and that's for us to commend you. And that means people are really interested in development of the community.
Thank you very much. 65-70% compliance. Mr. Yaban says it's commendable. Therefore, hope is not lost. Remember that at Manifest Direction, we pull experts, we continue to pull experts in the areas that you face challenges. This is in two modes. One would be the general discussions like now, where we speak to plenty people at a go, hopefully to ginger their interest for them to contact us on one-on-one sessions or group sessions that will be done using technology. Our team of experts around the world is ever willing to do that. We hope we have added some value to you today. We hope to be back again with another edition. Thank you.